Well, hello. This is a continuation of our exploration of the circulatory system, the cardiovascular system, and we're looking at the heart. This is VODCAST H2 about the heart, and we're going to look at blood flow through the heart and from the heart. Well, first up, blood flow, simplified look at it, continuing where we left off and from number one. The pulmonary circuit really deals with the right side of the heart. It pumps blood to the lungs and from the lungs to the left side of the heart. The systemic circuit pumps blood from the left side of the heart through the entire body and returns the blood through the superior vena cava to the right side of the heart. Taking a little bit closer look at this, pulmonary circulation, this is primarily the right side of the heart. The right side of the heart pumps deoxygenated blood to the lungs. The right atrium receives that deoxygenated blood from the body, pumps it through the pulmonary trunk system, the pulmonary arteries, into the lungs for an exchange of gases, carbon dioxide out, oxygen in. The oxygenated blood returns to the heart through the pulmonary veins. From there, we go to the systemic part of the heart's operation, and this is the left side of the heart. The left side of the heart pumps the blood throughout the entire body. The left ventricle pumps oxygenated blood out of the aorta, through the aorta. The aorta branches into many arteries that travel to the organs. These arteries branch into what are called arterioles. Now these are just smaller arteries. The arterioles continue to branch into thin-walled capillaries, and this is primarily for the exchange of gases and nutrients. The deoxygenated blood returns to the heart starting with venules. These are smaller veins that will get continually larger as they get back into the superior vena cava, which then dumps all the blood into the right atrium. So, in order to get the blood through the heart and at the correct pressure, we pump blood through heart valves. The heart valves, purpose of the heart valves is to ensure that blood flows in one direction only. And there are four valves we're going to look at. First is the right atrium. From the right atrium to the right ventricle, we pump blood through the right atrioventricular valve. This is called the tricuspid valve, another name for it. And the blood flows from the right atrium into the right ventricle one direction, and the valve prevents blood from flowing backwards. Well, blood flows from the right ventricle through another valve, the pulmonary valve. It's also known as the semilunar valve, into the pulmonary trunk and over to the lungs. Oxygenated blood re-enters the heart through the left atrium. So we have to get from the left atrium to the left ventricle, and it has to pass through the left atrioventricular valve, left AV valve. Another name for this is the bicuspid valve or the mitral, and this sends blood into the left ventricle. Then blood is forced out of the left ventricle through the aortic valve into the aorta and out into the body. And all this is designed for one-way movement of blood. Okay. So taking a look at these AV valves a little bit closer, if we take a look at the blood that is returning to the heart, this is number one on top. The blood returning to the heart fills the atrium, the right atrium, and it puts pressure against that atrioventricular valve and forces the atrioventricular valve open so that blood can flow into the ventricle. The ventricle now, as the ventricle fills up, it forces blood into the ventricles until such time as the ventricle is completely flooded, and the ventricles now begin to contract, right, to push blood from the ventricle into the lungs. Well, this force pushes the valve closed, so now the blood can only flow to the lungs and not back into the atrium. And what these chordae tendineae that are located, these are those strands that you'll see when you do your sheep heart dissection, actually tighten, and they prevent the valve flaps from everting into the atria. That means allowing blood, or allowing the valve to be pushed into the atria. They are held in place like by a little rope. The same situation happens at the semilunar valves. As the ventricles contract and the intraventricular pressure rises, blood is pushed up against those semilunar valves, pushing them open. So this is how we get blood out of the ventricle and into the lungs themselves. Well, as the ventricles relax and the interventricular pressure falls, the blood flows back from the arteries, filling the cusps of those semilunar valves, forcing them to close. And you will see these little cup-like arrangements that are just gravity driven. Okay. The disorders of the heart valves, there are a couple that we're going to look at. One is stenosis, and this is a failure of the heart valve to fully open. Second is insufficiency. This is a failure of the heart valve to fully close. And the third one is mitral valve prolapse, and this is where blood leaks back into the left atrium from the left ventricle, and this oftentimes is caused by just the force of the muscle from pushing the blood out through the rest of the body. Okay, here is a detailed picture of the flow of blood, showing you each one of the valves that the blood has to pass through. And you should take a good look at this and be able to actually draw this. Now, you don't have to draw this looking like a perfect heart. You can do this like I do. Just draw 4 boxes and make sure you can outline where those valves are located and what they are by name, and demonstrate the flow of blood. Well, here's a diagram of blood flow through the heart and the body. Left side is through the heart. That's what we just looked at. And right side is through the body. I like to start at the right atrium up in the top left. Sounds kind of backwards, but that's where it is. If this was the patient facing you, the right atrium being their right, your left. And this is the flow of blood. You need to know this flow of blood. You're going to see this on the test. This is just a common knowledge that you should have after study of blood flow in the heart. Just another look at this. This is the same blood flow. I put it in little words there in my little blood flow. But this would be a drawing showing, the brain, circulation of tissues to the head, and you'll be able to name those arteries after our next section, the circulatory system. And blood flows, as you can see, from the heart up to the brain. It flows. There's a blood flow to the lungs, and then the blood flow will to the lowest sections of the body. You see on the left side, patient's right, your left, pulmonary circulation, seeing a representation of the lungs. On your right, patient's left, you would see systemic circulation to the body. Okay, well, there's one other kind of circulation in the heart, and that is coronary circulation. Coronary circulation is the actual feeding of blood and nutrients to the heart muscle. And the heart takes care of itself first. It's got its own little private circulatory system called coronary circulatory system. And this branches right off the aorta. Very first branch off the aorta supplies blood to the left and right halves of the heart with blood. They're great in middle cardiac veins, return blood from the heart muscle itself to the coronary sinus and the right atrium. And one little problem here we call, one little definition that you need to know, anastomosis is the point where 2 or more branches of an artery serving the same area meet. So let's take a look at a picture of coronary circulation. And here you see, coming right off the aorta, you see the left coronary artery, and you see the blood flow. Again, this is feeding every single muscle cell of the heart. And then obviously the blood needs to return back to the heart so that it can be reoxygenated. Coronary circulatory problems, these are generally heart attacks, problems with chest pain and heart attacks. Myocardial ischemia is reduced blood flow in the myocardium. Remember, that's that thick muscle, part of the muscle of the heart. Ischemia causes hypoxia, right? To reduced oxygen, and this weakens the cells. Well, ischemias sometimes cause heart attacks directly, but most times it's just painful. So these may cause angina pectoris, which feels like a strangled chest, difficulty breathing, pain in the chest, and it's a symptom that something major is beginning to occur with the heart. Or sometimes it may cause what's called silent myocardial ischemia, which is painless. And this is very dangerous because you're having a problem, but you're not feeling pain, so you don't even know the problem is developing. Angina pectoris is a definite symptom to go visit your doctor quickly. Infarctions, these are complete blockages of blood flow. Heart attack, these are heart attacks causing death or weakening of a heart muscle, and they're called myocardial infarctions. So this is a complete blockage of blood flow through the coronary system to the heart. The extra credit question for today is, why does a lack of oxygen to the heart muscle cause irreparable damage to the muscle? I mean, once just because you lose oxygen, why wouldn't you just go ahead and make some more cells? So you need to be very specific in your answer, and make sure you have that to me by midnight tonight. Maybe here's a little hope for you. This looks at the 3 different types of muscles that we've reviewed: the smooth muscle, skeletal muscle, and cardiac muscle cells. Well, that's it. End of the VODCAST presentation for today. Please ask any questions about this VODCAST tomorrow in class. We'll have some activities to do, and I look forward to working with you tomorrow. Thanks.